Giving feedback is the first critical step in the brief intervention. It's important to get it right and set the stage to be effective. There are many key elements to successful feedback. The first is we ask permission. Typically, our patients do not come into medical settings to discuss their drinking or substance use. By asking permission, we respect and honor this fact. Don't lecture or try to right the situation. Instead, create a discussion. Try to understand the severity, what they like about drinking or using, problems they've noticed, reasons for cutting back, and their motivation. While health norms and information can be helpful, what's most effective is a simple message about your concerns and the health risks. Remember, what you say is not as important as how you say. Be explicit and direct, but non-judgmental and compassionate. In this scene, the provider has assessed the patient's drinking to be above safe limits. Let's watch as he gives some successful feedback.
You've answered some questions about your drinking today, and I wanted to make sure that we had a chance to discuss the findings. Would that be okay?
I guess so.
Well, you told me that you are drinking 4 or 5 times a week and having about 4 drinks each time. Is that right?
More or less.
I have some concerns about how that might affect your health overall. There's been quite a bit of research about this, and your drinking is actually over the safe limit. The low risk limit for men is no more than 4 drinks per day and no more than 14 drinks per week. What do you make of that?
Are you telling me I'm an alcoholic?
Not at all. What I'm saying is that the amount you're drinking can affect your overall health, and I want you to make some informed choices. Does that make sense?
I guess. I never really thought about it.
Well, can we talk now about your drinking and how it affects you?
Well, okay, sure.
The provider respectfully paves the way by asking permission to speak about this topic. He then rechecks his information, and instead of focusing on labels or problems, he discusses the health concerns. He rolls with some initial resistance, and yet his feedback is explicit and direct. Now let's look at the same situation where the provider misses some key opportunities for successful feedback and instead gets sidetracked by the patient's response.
Your assessment for substance use indicates that you're drinking 4 or 5 times per day, several times per week.
Why did you ask those questions?
We're asking all of our patients about their substance use to see if there's a problem, and in your case there is.
What do you mean?
Well, your drinking is well above safe limits, and we need to address it.
Hold on a second. First of all, I don't have a drinking problem. Second of all, I didn't ask for this, and I don't need your advice.
It's my responsibility to tell you if I think that there's a health concern.
I don't like where this conversation's going.
I'm sorry, but I need to be straight with you about my concerns.
First, he does not pave the way to talk about what could be a difficult situation for some and does not ask permission. Next, he labels and focuses on the problem rather than having a discussion. The communication spirals downward from there. Notice the time it took in this scenario is about the same as in the last. The results of the first scenario were much better.